Welcome to Touch of Class. I am Debbie Elliott. Welcome to Touch of Class with Debbie Elliott. I have a special guest today, Dr. Blum, Mitchell Blum. We call him Mitch because he's a Rotarian Club member with me, and we've been done several things. He's a pretty new Rotarian, but we have great time. Anyway, please, Dr. Blum, could you tell audience and camera who you are, what you really most do for a living, and introduce yourself, please.
All right. Again, my name is Mitchell Blum. I'm a physician. I'm a double-boarded ear, nose, and throat and facial plastic surgeon. I practiced in Sacramento for 35 years. And then worked for a company called Lifestyle Lift in San Ramon for a few years. They went out of business in March, and I was out on the street looking for work. Well, I have a good friend who is a plastic surgeon here in Tracy, and he told me to come to Tracy. You'll love it, and he's right. It's a very friendly place compared with the Bay Area where I live. I make the commute every day, but it's an easy commute. I joined the Rotary Club because I've been a Rotarian for about 20 years. I'm big on community service, and that's
See, you lucky that name to me.
Yeah, that's it.
But anyway, soon as I found out you were a plastic surgeon, I wanted to make a friend. so I can have this kind of face. I'm sorry. But still, it's way too high, and my husband said, no, so he's not going to pay for me, and he doesn't want to pay, so he said, no, you don't need. I know I need it, but anyway, you were major for U.S. Air Force.
Yeah,
so you joined at the Air Force. How long you been joined the Air Force?
Okay, so I joined the Air Force when I graduated medical school in 1968. And they allowed me to go through 5 years of specialized training. And then I went active duty for 2 years in Sacramento at Mather Air Force Base.
So you were the military doctor, ENT?
Yes.
Not the plastic surgeon?
No, I was doing facial plastics
really?
and ear, nose, and throat.
Oh, is that right?
I was doing a rhinoplasty on the base commander's wife the same day the newspaper came out with an expose about cosmetic surgery in the service. Anyway,
wow. I know in the audience a lot of people interesting.
Yeah.
If price is right, they might like to do it. So how long now in Tracy? 9 months?
Yeah, I started the process starting up a practice here in August. When I finished medical school and my residency, it was very easy. You went to a hospital and said, I want to work here. They said, great, and you started working. Now it's a process of going through hospital credentialing, which took a couple months, being credentialed by the insurance companies, and all of that really just finished around the first of the year. So
wow.
I'm finally getting busy and working, but it was a much slower process now than it used to be.
I read your bio. You've been doing it over 3,000 cases, the plastic surgery and facelift, and also injection, what they call?
So the fillers, the Botox, the muscle relaxants, and all of the facial procedures I had done for many, many years in private practice. In 2009, I joined Lifestyle Lift, which basically brought cosmetic surgery to the masses. And they did a very good job of it until the owner of the company got overextended and lost everything.
Wow.
Went out of business in March. But with them, just in that 5-year period, I did about 1,600 facelifts and maybe 1,000 eyelids, and it was a tremendous experience.
I need so many places to fix it.
No, you don't.
Exactly. So you are originally from Philadelphia.
Yes, I am.
What made you to come here?
Oh, the Air Force.
Oh, Air Force. Oh, okay.
I had never been
Okay.
west of Pittsburgh until they told me I was stationed in Sacramento. And this is the height of the Vietnam War. I got stationed in Sacramento, which is sort of an interesting assignment. It was a good one.
So you moved here, and then you went back there a little while, but you came back again,
Right.
and because you like here.
That's correct.
And you married here, or you married in Philadelphia?
I was married once out of medical school. I was back there for about 25 years. I've been married to my present wife for 20 years.
Okay.
And I met her playing tennis at my tennis club in Sacramento.
That's right.
Yeah.
You are playing golf, tennis,
Yeah.
and you do a lot of stuff.
Ski, sail.
Yes, yeah. I used to play golf every single day, 7 days a week. And I was chairman of International Diplomat Wives Golf Club's president. And I also president of a tennis club. I used to play tennis and golf all the time. But after you get certain age, you just can't keep up those stuff.
You can slow down a bit.
Yes.
My neighbor across the street, who is 84 years old, just was inducted into the National Track Hall of Fame.
Wow.
82 years old, she did her last Ironman in Hawaii.
Wow.
So the number doesn't mean anything anymore, as much anymore as it
That's
used to.
true, and just enjoy it. Yes, yes. So you enjoying this job?
Yes, I do. I like to work. I like to do what I do.
Yes. So where is your address? That
So
clinic is?
I'm on West Grant Line, 2160. People know the ophthalmologist, I guess the optometry office there. There's a surgery center. My partner's
The Dr. Tsuchiya's office?
McNamara. Yeah.
The downstairs Dr. Tsuchiya's office?
Yeah.
Yes. Oh, okay. That
yeah.
building.
Right. So I'm upstairs
Okay.
with Dr. McNamara.
I see. Okay. Anyone like to ask question? How price is and okay, please. She has questions.
Right.
I'm interested in facial hair removal. Do you do that?
That you would probably see a dermatologist for. That requires a special laser that most dermatologists, not most dermatologists, but mostly in dermatology offices is where you would find it.
Okay. Another question?
Is this person that you have affected with your new nose, or is there a certain age limit that you have for the youngest and the oldest?
No, actually, and I said before, the number doesn't mean anything. It's who you are, where you are in your life, what your general health is, what your activity levels are, and you know what's important to you. So, I've done a number of people late in their 80s for facelifts, but generally it's younger than that. And as far as the young age, again, it depends on the pathology. It depends on why somebody's doing something.
So it's not just people wanting to get more beautiful or look younger. You actually do reconstruction when they can't breathe, or that type of surgery?
Correct.
As well?
I do reconstructive surgery as well as cosmetic surgery.
Thank you.
Right.
Anyone else? Okay.
Just out of curiosity, what is the recovery time on a facelift?
Okay. I mean,
Are you serious? You want to get it?
There's no short answer. I've did one of my office people a few years ago, and she was a professional in my office, and she was back at work in 4 days, wearing a scarf and hiding things, and just worked a couple hours and went home. You could be up and about and doing most of your activities after a couple of days, but you're going to have stitches in, there'll be swelling, there may be bruising, so I usually say 2-3 weeks before you're really totally socially acceptable. All right.
Great, thank you so
Yeah.
much.
Okay, maybe summertime, we have no meeting between June and September. You and I can go talk to him. Okay, and you have 2 children, grown-up children.
I have 3 grown-up children.
3 grown-up children.
Well, actually, 3 of my own, 3 grandchildren, and 2 stepchildren who I raised.
Oh, okay.
When I got married to my present wife, I had a 9-year-old and a 3-year-old.
Oh, okay.
Her kids.
So she must be pretty young.
So they're
ladies.
my kids too.
Okay.
Yeah.
So they are all here, or?
Got one in Sacramento, one in San Jose, one in Tahoe, one in New
So
Orleans, and the other one in
everywhere.
Massachusetts.
So everywhere.
Yeah, they're all
okay.
over.
Yes. So you really think you like Tracy?
I love Tracy.
Are you gonna-
I have had nothing but a nice welcome here.
That's
Yeah.
great.
Yeah,
You know, a lot of people like me, sweet.
right. It is. It's a wonderful change in pace from the Bay Area. I get to run away from that, and
Yes.
Professionally, I've been very welcomed in town too. which
That's
is good.
very important. Yes, that's good. So you belong to Sutter Tracy.
So Sutter Tracy and Doctors Manteca.
Oh, okay, Doctor's Hospital.
Yeah. yeah.
Okay, okay. We had one time Doctor's Hospital's CEO. His name
That was
is
Nikki.
Nikki
Yeah.
Tahada.
Yeah, yeah.
Yes, he was in my TV show,
Okay.
but he's gone to the Chicago now.
Yeah,
Yes.
yeah. He actually recruited me down to Doctors. When I was first looking,
Is that right?
he had heard that I was coming, and they said, "We need you here." And
Oh, wow.
he was one of the people that got me going too.
Yeah, he
Was-
came my show,
Yeah.
and he told he's going to enjoy the work in the Monteca. And about a week later, I heard he's moving to Chicago. So
His replacement's a very nice fellow too.
yes,
Yeah.
I met him a couple
Yeah,
times.
right,
Yes,
Ike,
yeah.
yeah.
Yes, we're trying to bring him in. Oh, anyone have a question? Yes.
I'm not exactly sure what Botox and fillers do. Could you tell me what the difference is and what they are?
Okay, so a number of things happen with the aging process. One of the big ones is we lose volume in our face, and that's what the fillers are for, to fill in the lines next to your nose, maybe fill in the space between your jowls and your chin, just to give you back some of the volume. The Botox, which comes in a number of different brand names, Botox, Dysport, there's another one that I've never used, is a muscle relaxant. And what that does is relax your muscles of expression. So if you're always walking around angry because you're, they call them the 11s up here, put some Botox in there, it'll relax it. Now that could be a good thing, it could be a bad thing. My former partner's wife, I wanted to do her, and she said, no, my kids wouldn't know when I'm angry at them. So, but it's really a muscle relaxant.
Oh.
Yeah,
Well, thank you.
you're welcome.
So Botox helps like muscle pain?
It actually was developed originally for diseases of the muscle, like strabismus, uneven eye movement, torticollis, tightening of the neck. And it was noted by the doctors who used it that when they gave this treatment, that the wrinkles went away.
Oh.
And that's how it got into the cosmetic part.
So the Botox take a wrinkle away.
It will take away fine wrinkles, yes.
Wow.
Yeah.
I like to have right now.
And that you can afford.
So anybody question anymore? And if you like, yes, please.
Good afternoon.
Yes.
The question is when you think of cosmetic surgery, you kind of, I guess you lend towards the fairer sex. I guess my question is do you have a lot of male customers? I mean, is there a large amount of men that actually come in for cosmetic surgery as well?
An increasing number. Men do get facelifts, actually neck lifts, because I don't like the waddle. Eyelid surgery, a little bit more common. And I would say probably around 12 to 15% of my practice is male.
Wow.
Interesting.
Surprise.
Thank you.
You're welcome.
Yes. Geez, the men wears the makeup some men wears, you know, so I guess they like to be beautiful too.
Well, you know, we could be vain. Yeah.
So you have more ENT or plastic surgeon. Which one more you have right now?
Right now, it's more the cosmetic surgery because that's what I've been doing a lot of. The ear, nose, and throat part is something I have to reestablish and is increasing.
I see.
I saw, I think, 6 or 7 people in the office today, and 2 of them were ear, nose, and throat. The other 5 were
Cosmetic.
cosmetic.
Do you take any insurance?
I take most of the insurances.
But the cosmetic surgery is not.
That's not.
No can use.
That's not covered. Not the cosmetic part. There's some insurance will cover eyelid surgery. So you know that
That
but
takes insurance. Pay
that
for
will take insurance sometimes.
sometimes.
Yeah.
Well, when you get older, eyelid come down, and that case, I guess you can use it for.
Yeah.
Okay. Yes.
Another question.
Yes.
What is the #1 cosmetic surgery that women have done?
The most frequent ones? That's probably a good question because I'm basically facial plastic, and the biggest thing is facelifts. Probably second is nose rhinoplasty. It really depends on, as far as the doctor, what he sees is what his reputation is. For years, my reputation in Sacramento was as a nose surgeon. So I did a lot of rhinoplasties, not as many facelifts. When I went and worked for Lifestyle Lift, it switched in the other direction.
Thank you. What is nose? What make a nose bigger, or what
All
the
right,
kind?
so I have 2 reasons, well, a number of reasons people would have nasal surgery. A lot of it's genetic. You have an ethnic nose that's really big, or prior injury where the nose is crooked or
I see.
deformed, where we could straighten that up.
I see. Okay. We really had enjoyed it, and I know that most women really like to know, but it's so hard sometimes. Kind of like embarrassing to go ask, you know, what you can do my face.
Okay.
so this is great. Thank you very much.
You're welcome.
And I know you're busy, but I really appreciate you coming to my show.
And thank you for having me.
And we'll see you next Tuesday.
Very good.
Yes, thank
All right,
you.
I expect to pay a fine.